Hi, I'm Dr. Vincent, and this is another educational patient video for low-dose immunotherapy. The topic of this one is treatment compatibility. Okay, it's very common that people want to know, well, what other treatments can I do at the same time as LDI? What can I not do at the same time as LDI? You know, are the dietary restrictions and avoidance things that I hear about necessary? So I want to address that for people specifically because it's common questions, and then if you know the answers before you try to contact us, we don't have to waste a lot of time answering them on an individual basis. So, in my experience, I haven't really found other treatments to directly interfere with the effectiveness of LDI, maybe with the exception of other homeopathic agents that affect the same thing, only because we're trying to achieve the same goal with the same kind of technique and they directly kind of conflict with one another. It's like taking your LDI dose repeatedly within the same time frame. That can be a conflict or a problem. But even things that are like really strong immunosuppressive drugs like Enbrel and Remicade and methotrexate, things like that, they don't seem to interfere with the effectiveness of LDI at all. Neither do antihistamines or other allergy medications. And that's been a common one in my history of treating patients with severe allergies, is that they live on antihistamines every day, and when they're told they have to stop their antihistamines for the week before they're dosed, and they say, I can't do LDA then because I'll die in that week or I'll be non-functional. So I just let people take them, and my experience was that it doesn't matter. And I think because the way in which these antigens are interfacing with your immune system at the initial phase is completely different from how all those other things work. So it doesn't really cause a problem. What can cause a problem, and more of the problem in this area is confusion, right? Is if you take something that is controlling your symptoms 100%. So if you have muscle and joint pain as your primary symptom, and you're on marijuana every day, twice a day, or you're on OxyContin or whatever, you're taking something that makes you pain-free, then we give you a dose. We don't really know if that dose worked or not unless you kind of withdraw it, right? But you don't have to stop taking that thing ahead of time. Don't stop it before you talk to me. What I suggest people do is that we give them their dose, and then about 5 to 7 days later, they try to wean off of their pain control and see if their pain comes back the way it normally would. So you can withdraw the symptomatic therapy after the dose is taken. Not a problem beforehand, okay? The other big issue that's most relevant for most of you is just getting confused. So if you're about to start some other therapeutic regimen, like ozone therapy or IVIG, or some mold detox protocol or chelation therapy, or some homeopathic regimen or whatever that's supposed to be helping you with the same thing that I'm treating you for, don't start them both at the same time, because you will have no idea which one is having which effect. If you start to feel worse, you won't know which one it is. If you start to feel better, you won't know which one it is. So that's just common sense, okay? And it's not that those therapies conflict with one another physiologically, it's that they conflict with one another intellectually, okay? We don't know what's doing what, and the whole game here is to figure out a puzzle. And so if you mix two jigsaw puzzles together, good luck figuring either one of them out. And so my advice is, if you're about to embark on some treatment protocol, especially if you already paid for it, that's really common. People say, well, I have this thing I ordered and it's on its way in the mail. I'll probably say, well, then you already paid for that. Why don't you try that for 2 weeks or a month or however long it should take to see a response? And if it works for you and you're asymptomatic and you're cured, great, you don't need me. If it doesn't work for you, then abandon that and we will send you doses and try our protocol. It's still worthwhile to talk to me and get the plan put in place and say, if that has no effect, here's what we're gonna do, okay? And that's worth your time if you just wanna be prepared and you don't wanna lose time. If you wanna do one thing at a time, then don't call me and don't have a visit until you have tried the other treatments that you intend to try, because then you're just gonna give me the same, confusion and discussion a lot of people do. Say, which one should I do first? I'm like, that's not for me to decide. I don't make decisions for people. I just try to help to the best of my ability whoever shows up every day and asks me for help. But it's your money, it's your time, it's your risk, and you've got to decide which treatments you want to do in which order. Just don't do them at the same time, okay? That's the only real issue. Supplements are not a problem at all. The one I really harp on that I think improves your success with LDI is vitamin D. My usual standard dose for adults is 10,000 units a day. And the blood level I like to see for people is between 100 and 150, usually 120 to 150 nanograms per milliliter. That's American units. So if you're Canadian or British or European, 100 of ours is equal to 250 of yours, so somewhere between 250 and 350 in European and Canadian units. I think that's the ideal range. I have my own reasons for that. I won't go into it now. If you try taking a large dose of vitamin D and you have a negative reaction to it, I want to know about that, because it could mean you're having a Herx reaction by killing something, and that's very informative for me. And then you just have to take less, whatever you tolerate. You can't crank it up to 10,000. If we're dealing with a child, the vitamin D dose I suggest is about 1,000 units a day for every 10 pounds of body weight. So a 50-pound child gets 5,000 units a day, and so on. As they grow, you tag it on. Once you hit 100 pounds, the math works out to 10,000 a day, and you stay there. That's the only supplement I care about. Anything else you want to ask me about? Can I do this? Can I do that? I'm going to tell you, sure, I don't care. So knowing that now, you don't have to wonder and ask the question and wait to do something, as a result. So your other therapies, your other supplements, stuff, as long as it's not another form of immunotherapy, it's not a form of homeopathy, and it's not a bioenergetic treatment that are targeting the same antigens that we are, then it's fine. Like if you're being treated for candida sensitivity with some homeopathic product, and I'm treating you for Lyme and food allergies, go ahead, use the candida thing, it's fine. It's not going to conflict because we're not overlapping in terms of antigen. But if you want to use the Desiree Biologicals Lyme remedy and my Lyme LDI at the same time, that's a horrible idea, because they will both be trying to achieve the same goal in the same way, and they will probably make both of them work badly, and you won't know which one it was. And then you burn a bridge that could have actually gotten you to your goal. So if there are residual questions about what you can and can't do, feel free to email us, customer service@globalimmunotherapy.com. Thanks.